welcome back to the TLB YouTube channel. I'm Tabitha. This is
I'm Lauren.
yeah. And today we're going to be talking about a really basic introduction to pregnancy, nutrition myths, and maybe how you might approach the basics of nutrition through this time. It's a really overwhelming topic because it is such a personal experience, and there really is so much advice out there, including advice from all kinds of scopes of practice, which can make it even more confusing. Sure, there's like the influencers, right, who are just sharing their lived experience, but there's also dietitians and OBGYNs who are sharing a variety of opinions too. So this can be a really confusing time, even if you're getting lots of good information from all kinds of places. And so that's really the most important thing to remember in the pregnancy process is that the fear mongering around information is not helpful to you or the baby. And so, if you can come into kind of a place of peace around a lot of this information, it's going to be such a helpful guide, even as you navigate the really complex clinical medical topics. So, and
Yeah.
lastly, I'm just going to kind of share what we're really aiming to achieve in the video, which is basically just to focus on balance and nourishment and trusting your body in the process of pregnancy and things will come up as they come up and allowing that to happen and really just striving for that grounded balance over perfection or fear. So
Yeah, I love that. And kind of off the same note about the fear mongering that exists in pregnancy nutrition overall, it's really important to acknowledge just how many pregnancy books, social media, and other resources really emphasize restriction and risk around being pregnant, which
yeah,
creates so much anxiety around doing it the wrong way.
yeah.
And so, a lot of common messages around pregnancy that I come across usually include long lists of forbidden food and pressure to eat perfectly, but fear doesn't equal better outcomes. And in fact, chronic stress and guilt can negatively impact both parent and baby in these situations. And so I would love to hear more, Tabby, about some basics for reducing some stress around pregnancy nutrition and the overall preparation during this time.
Yeah, totally. I think what's really important to know is that, when you find out you're pregnant, sometimes people go into this headspace where they're like, oh my goodness, I have to change everything immediately. And that is kind of one of the basic things I'd recommend against. Like, really, you do not need to, wake up and see a positive pregnancy test and then all of a sudden completely change how you're eating. Because what you're doing is most important to stabilize how you are continuing to move through the pregnancy. And then, of course, as you gain new information, you can go from there. But I really do think there's so much sensational information around needing to immediately switch things up, or like Lauren was saying, restrict. So you can continue the patterns that you've already been doing that feel supportive. You don't need to change something just because you see that there's information out there that is, directing you a different way at first, right? There may be some things you choose to change over time. There may be some things you run into that you have to change given medical situations that may come up in pregnancy. But overall, continuing what feels supportive to you is the most important thing that you could do. So this might look like continuing having balanced meals that you're looking at and or that you're already doing regularly, enjoying movement that you're already doing. I think we'll talk about that like a bit later in the video, but you do not need to think that something is going to immediately change about your nutrition needs when you learn that you're pregnant. And when it comes to movement, actually, I'm going to review it now. Sorry, I got that timeline off. So when it comes to movement, you really are wanting to just continue what you're doing and not kick up the intensity all of a sudden. And the reason is because what your body is used to is what is going to be most safe for the baby. Because we're talking about blood flow to the fetus that could be reduced if you're all of a sudden going to, do marathon running when you never were marathon running prior. That's obviously an extreme example, but it's to kind of make the point that when it comes to exercise, stay stable. Pregnancy is not the time necessarily to pick up all of these new movement habits. Sure, if you have no movement practice, then yes, it's helpful to start a movement practice. But it would be, excuse me, more in the gentle sphere of things. And you would really want to be focusing on doing what already works for you and not going outside of that. Yeah. All right. So moving in a little bit to really a message that I think is so important for pregnancy and postpartum, and as it comes to nutrition and also just the process of navigating pregnancy and recommendations and having a baby, which is listening to your body. It is so normal to have wild fluctuations in pregnancy in your hunger, your fullness, your cravings, aversions, all those things. Not all people experience nausea and fatigue. Not all people experience, these things at the exact same time in pregnancy, even. But what's okay and normal is to lean into that, right? So remembering that your body is able to handle those changes. And so if it is that you need to lean into eating only what is tolerable when you are so incredibly nauseous, do not force the vegetable, right? If it's going to make you throw up or if you feel terrible eating it. I think those are really important things to remember in the process of pregnancy that your body has very many capabilities when it comes to providing your baby with what they need. It's not this like direct line. I remember somebody telling me the other day, they're like, I don't want to drink a Coca-Cola because then my baby's gonna like drink the Coca-Cola. And I'm like, no, that's not. I understand the fear. The fear is, valid based on all the things that we see around us and what we hear. But that's not how it works. So just remembering that you can lean into the ebbs and flows of pregnancy, and that is going to be a skill that you continue to utilize in the postpartum period. And so if you can lean into that in pregnancy, you're getting great practice for how that might have to continue in the postpartum period. So I just would encourage people to tune into their hunger, their energy cues, make sure that you are resting when you need to. Do not force exercise when it doesn't feel right. And just remember that flexibility across the trimesters is the name of the game in pregnancy.
So wonderful. And that's such a great overarching message. And as we move into some of the key nutrients to be mindful of in pregnancy nutrition without obsessing over them, I really want to emphasize the gentle nutrition aspect of utilizing some of these nutrition science concepts and what we know about what nutrients are helpful in the process of pregnancy and keeping that flexibility in mind. So, with that being said, I'm going to go over a few of the key nutrients that provide support to a healthy pregnancy and keeping in mind that individual needs will differ and perfection is much less of a focus than overall inclusion and just awareness of these nutrients and what contains these nutrients. So I'll start us off with iron. Iron is an important nutrient in pregnancy because it supports the increased blood volume during pregnancy and helps deliver oxygen to both parent and baby. Adequate iron intake reduces the risk of anemia, fatigue, and complications related to low oxygen delivery. Some foods that iron is found in are things like red meat, poultry, fish, beans, tofu, spinach, leafy greens, and fortified cereals. So, some things about iron that are helpful to know is that pairing iron rich foods with vitamin C can actually improve its absorption rate in the body. And many prenatal vitamins actually contain iron, but some individuals may need additional supplementation depending on your lab values and the levels you have going on there. Iron supplementation can cause constipation, so it is helpful to know this and focus on hydration, moderate fiber intake, and if needed and recommended by a PCP or dietitian, Miralax or magnesium supplementation can be added as necessary to help with the motility of the gut. So that's a little bit about iron overall. The next big one is folate. So folate plays a key role in early fetal development and preventing neural tooth defects in the first trimester. This supports healthy cell growth and DNA formation, and food sources include those leafy green vegetables, beans, lentils, citrus fruits, and fortified grains. And prenatal vitamins, once again, typically provide folate in the form of folic acid or methylated folate, both of which are effective for most people. So you may notice folic acid or methylated folate options, as I just said. Folate is the natural form found in foods like the leafy greens, whereas folic acid is synthetic or the man made version, which is used in supplements and fortified foods. Another key nutrient is vitamin D. And so this is crucial in supporting bone development, immune function, and calcium absorption for both parent and baby. It is found in fortified dairy or plant milks, eggs, fatty fish, and even in sunlight, as you might have heard. Many people are actually low in vitamin D, so supplementation through a prenatal or an additional supplement may be recommended based on blood levels. This is something that isn't usually surprising if this comes up.
Mhm.
And another similar nutrient in bone health is calcium. And so this is essential for the development of baby's bones and teeth and also helps protect parents' bone health. Good sources include milk, yogurt, cheese, fortified plant milks, and leafy greens. And prenatals do not often actually contain the full calcium requirement. So, meeting the needs through food can be important and helpful, and also additional supplementation if needed. So, a couple more here. There's omega-3 fatty acids, which are essential for fetal brain development and neural membrane integrity. A major food source for omega-3s are low mercury fatty fish like salmon, but enriched eggs, milk, and other dairy products can also provide these nutrients. And then a bit larger nutrient, a macronutrient that I do want to touch on is protein, which is quite the craze right now in the media.
Yeah.
And I don't necessarily recommend or find it necessary to obsess over protein, but
Yeah.
it is a helpful macronutrient in pregnancy to assist with the growth and increase in blood volume that is occurring in the pregnant
Yeah.
body. So, aiming to eat a protein source with your regular meals is a great way to ensure you are consistently getting what you need. And that's about it on protein, right? Just kind of having those touch points with protein as well as all of the other key macronutrients as well. So, keep in mind, tracking every nutrient is not necessary. A varied diet includes some of the options I've listed. If they appeal to you, plus a prenatal vitamin is usually sufficient to cover your needs. And most prenatals will cover all the other vitamins that we need as well on a daily basis. And so, with that being said, right, like many pregnancy related topics, such as foods to eat or avoid, this can all bring up really strong reactions and anxiety. And it's really important to just remember the context about the recommendations and explaining or knowing the reason behind things. This is what helps us better understand our options rather than simply being told, eat iron, eat protein, eat folate, right? It's kind
Yeah.
of more knowing what these things do that allow you to make the choices that are best for you when it comes to gentle nutrition in pregnancy.
hmm Definitely. Yeah, in the same vein, around kind of the panic, obviously food safety during pregnancy is, paramount, and it's something that there are a lot of recommendations around. There, we're not going to go into all the specific recommendations in this video, but I think what's important to note is that when it comes to food safety recommendations in pregnancy, these are risk mitigation as opposed to cause and effect. That's the best way that I could describe it to people. So it doesn't mean that eating a piece of deli meat is going to always have listeria, which is going to always end a pregnancy. There are many, many steps in between that could, make that true or make that not true. And so I think it's always important for people to understand that instead of this really black and white mindset around, don't eat this, this causes this, where it really is not cause and effect, but rather risk reduction. And if somebody is going to eat some of the foods that are not recommended, I think something that I love to share from a harm reduction standpoint, right? Because there are going to be a lot of people who don't ask any questions because they're afraid of what their OBGYN might say if they know that they are eating a deli meat or they are eating sushi or whatever it might be. But use reputable sources for those foods when you're doing them. Make sure that foods haven't looked like they've been sitting out for very long. Obviously, there's only so much risk mitigation you can do, but using reputable stores and places to purchase these foods if you're going to eat them is one route you can take to feel that the risk mitigation is a little bit more contained. So yeah.
Mm. Love that. Yeah. I think that what I'm hearing too throughout our conversation is a lot of, not focusing on the perfection. And I don't even know sometimes what that means with perfection because what are we comparing to, right? Like some of these
hmm
really extreme things we see in the media, probably. And so just
Yeah.
emphasizing once again, balance is more important than that perfection, whatever that looks like to you. And pregnancy is really not the time for the dieting, the restriction, the clean eating pressure. And now more than ever, it really is the time for those regular meals, snacks, enjoyment, satisfaction, flexibility.
Yeah.
And so a nourished, less stressed parent is one of the best supports for that healthy pregnancy when it comes to all of these topics as we get into the weeds with nutrition.
Yeah, yes, I could not agree more. Really is such a helpful way to zoom out of, there's so much hyperfixation on certain things during pregnancies, and it's just not helpful a lot of the time. So there are scenarios, and we won't go into it in incredible detail, but there are scenarios where you may need more support in pregnancy. And it should be known that there is no judgment or shame for reaching out for support in pregnancy because there are so many scenarios in pregnancy that do require additional support. One I'm thinking of that is pretty obvious, but is definitely something that happens a lot is gestational diabetes. So it's a type of diabetes that develops during the pregnancy when the body has difficulty regulating blood sugar levels. It has to do with the placenta. So there is nothing you're doing that is causing your gestational diabetes. No matter what the internet says, that is not something that is clinically, currently something that we know. There's all kinds of ways that people manage gestational diabetes. Typically, the route is dietary recommendations and changes come first. And then, if blood sugars are still out of range in that case, then medication may be added on to manage the blood sugar. And there's all sorts of outcomes that can be associated with gestational diabetes. I think something that's really important to know is when it comes to nutrition care with gestational diabetes, getting enough nutrients is just as important as, the dietary changes they're asking you to make, which, we can go into more in the future, but the balance, it really is the center of GD care. Balance, fiber, protein, fat, carbs, and, again, we can get into that in a future video if people want a more detailed approach there. Um, and of course, gentle movement is very helpful for blood sugar when accessible, but I do think it's really important for people to come back to there isn't necessarily a drastic change. And if you are being asked to make a drastic change that is feeling like you're not getting full or you're feeling really fatigued because of all these changes, it is worth having a conversation with your provider instead of just, powering through that for the sake of feeling like you don't want to be medicated or you're afraid to experiment with other foods, right? So that's all very, very individualized care, and that is appropriate, for dietitian sessions. And so that's why if you're struggling with that or if you're feeling confused, definitely please reach out. We would love to help you in that regard. And it is definitely not the only case when somebody needs individual support in pregnancy, but it is a really common one as it relates to nutrition and lifestyle changes.
For sure. That's all such helpful information and a really great foundation overall to keep in mind for pregnancy nutrition. And with that being said, I think from what we've reviewed today, it really reinforced that pregnancy nutrition doesn't necessarily need to be fear-based, and continuing with what worked before pregnancy is usually appropriate. And so when it comes to your individual journey with pregnancy, listening to your body is really what's most important, and nourishment and flexibility really, really matter the most, and getting individual care on top of that as needed for your specific needs on top of that. So if you enjoyed this video, be sure to like and subscribe, leave questions in the comment section for us that you might want follow-up discussion
Yeah.
around. We're happy to do that.
Oh, yeah.
And be sure to explore prenatal nutrition if you need with support at TLB Nutrition Therapy.
Cool. Thanks, Lauren.
Thanks,
Bye,
guys.
guys.